Now I'm going to show you how to prepare somebody's foot before you stand them up. One of the most important things about our foot is its sensory function. So when we're standing or walking, we get feedback from the muscles in our foot about where we are in space. So getting appropriate feedback from a flexible, sensitive muscle is really important. So often neuro patients will have very tight muscles in their calf and foot. So when they stand, the leg's very stiff and they're not getting appropriate feedback, so their balance is very poor. So it's really important before we stand a patient to mobilise the muscle to reduce its stiffness and do some stretching to improve the flexibility of the calf and the foot. So that's what I'm going to show you now. So Jan has the hemiparesis on this side, so she's developed some stiffness and tightness in her calf and in her foot. So it's really important, firstly, that I'm going to do a physiological stretch to the muscle. So it doesn't matter really what position I'm in, but I need to have part of my leg where I can put her forefoot to get a nice physiological stretch of her calf. Some people kneel down and have the patient's foot on their knee. I'm more comfortable in this position, but this doesn't matter. So I've got her leg aligned nicely and we've got a nice stretch coming down her calf. In real life, with a patient with a real hemiparesis, the leg might be like that because the foot is pulled with spasticity into plantar flexion. So here I've got this stretch, and now I've got the physiological stretch on her foot and her calf, and I'm going to start mobilising the soft tissue. So I'm going to do a slow, passive stretch. Remember that fast movement will stimulate the stretch reflex, so it's important to do this slowly. So I'm doing a slow stretch, deep massage into the muscle to try and reduce the stiffness and affects that thixotropic property of muscle to try and loosen it up and make it more mobile. So I started proximally and I'm working distally. Note I'm not gripping with my fingers, but I'm using this lumbrical action to mobilise the muscle. Very similar to what we learn in MSK, but in MSK we call it specific soft tissue mobilisation. In neuro, we tend to call it inhibitory mobilisation. Right, so I've softened the muscle now. In real life, it would take longer than that. And I'm going to move down into the foot. Again, it's important not to use a grippy action because you'll tickle the person's foot. Carry on using this lumbrical action. So, and you don't find that ticklish, do you?
No.
So, and I'm working on really what I feel. So I'm feeling what feels tight and I'm mobilising there. And I can feel your joints are a little bit tight, so I'm doing a little bit of joint mobilisation as well. I'm keeping the stretch on the calf and stretching the patient's muscles. So I'm getting a nice stretch here now. And I might even try a further stretch. And that's as far as you'll go, really. So once I've got the patient stretched out, I'm going to put her foot in a nice position. I'm going to get you to lift your heel and lower it. So she's using her muscles now in a nice normal way without activating the spasticity. In real life, often this would trigger some clonus like this, and you have to try and get the patient to control it as they move up and down, and you can use your handling to try and relax it. Okay, so we've got a lovely position now, nicely aligned foot, and I'm going to give an even better stretch now by getting the patient up into standing. So I'm going to keep this position nicely. If you could come forwards and stand. Right, now I've got the patient nicely supported here and I've got my hand over her knee. Can you step forwards with your good leg? And now I'm going to give an even better stretch on her calf. So this is similar what you would do with an MSK patient doing a calf stretch, but obviously with a neuro patient you have to support them a little bit more and be careful about triggering spasticity. Okay, start to sit down and I want you to feel that stretch. And now stand up again. Very nice. Sit back. and come up, and we're getting a beautiful stretch there on the calf. This time all the way down. Very nice, really well controlled. And you could go into walking if you were working with a patient who wants to do some gait re-education. You could go straight on into walking practice.